the size of a hospital they need, and the components that they've already discussed. So they've discussed 3 or 4 levels. And thank you for your offer of additional information, directors. And thank you, directors, all of you, and for your assistance in this. Sizus Masi. Well, now, except we still have signed up to testify. Maybe we'll just try and see if we can fit. Anyone else who signed up to testify, please come and have a seat. All right. Thank you. I guess we'll proceed in the middle. If you could introduce yourself, please.
Thank you, Madam Speaker. My name is Dr. Jonathan Thorpe. I'm an internal medicine physician and the medical director for the Guam Seventh-day Adventist Clinic. And it's, thank you for the opportunity to be able to speak today. I want to share just a little bit of a personal perspective before moving to Guam. I've mentioned in prior testimonies unrelated to this topic that I worked in the country of Nepal as a chief operating officer for a mission hospital. And I have to smile at a couple of facts. One is that we had water pouring through our roofs, and we had snakes coming through our roofs. And this was in one of the poorest countries in the world. And Madam Speaker and Senators, I have to say I'm a little appalled that when I see pictures of the conditions my colleagues are working in at the current facility, water pours through the roof and snakes come through the ceiling. I have to smile because here we are, the wealthiest country in the world, and it's really shameful that we have a facility that is this poorly operated and run down to the point where my colleagues and my patients are having to work and function. And so the appeal of my story is that we need to move forward with the decision to move a hospital and build a hospital quickly, not wait for years and years of back and forth between party sidelines to make a point. Patients are dying because they don't have access to care. And that brings me to several points, and I'll just briefly mention each one. First, I have to smile at the conversation that I've heard this afternoon on the whole topic of size. As an alumnus of Loma Linda University Medical School, which has had a long relationship with the territory of Guam and has many physicians have worked here, I just pulled up on Google Maps and I mapped out the surface area of the campus. If you take the entire core campus of the medical center, including a large acreage for parking, it's 65 acres. If you look at the core area where there's the three hospitals and the faculty medical offices with a huge parking garage, you're looking at about 35 acres. If you look at the core area for just the actual hospital, the pediatric hospital, the old hospital that is being repurposed into research area and administrative spaces, and the new hospital, you're looking at about 21 acres. And so this argument that I hear that there's not enough space at EPAL Point, I smile at, because we, as now a resident here on the island of Guam for 2.5 to 3 years, I recognize that property value is incredibly high. And you can't build on water, you can only build on solid ground. And so it only makes sense to me to go up, not out. Go up, not out. And so I just appeal to us, to move forward with the decision. And I'd like to make the point out that there are hundreds of thousands, if not millions of buildings around the Pacific Rim built on fault lines. Engineers have had an incredible technologies to build with buildings that can actually move with earthquakes across fault lines, and they don't fall down, including hospitals. And so this argument from a lay person's perspective, not an engineer's perspective, but a physician's perspective, it's hubris. It doesn't make any sense at all. And so I would like to just make the point that, again, that engineers are very capable of building across fault lines. Secondly is that, thirdly, is that when I look at the existing healthcare facilities in Guam, one of the key areas is mental health. And there's a huge paucity of mental health practitioners and services here. We don't have unlimited funding. We're running out of time on the funding that, from my understanding, that the feds have put in through the COVID-related emergency funding. And if we don't move quickly, we lose that funding. So why are we going to replicate and build new buildings where we already have existing buildings that would work very well? Case in point, the behavioral health services. We have a good facility there. There's room for expansion there. Why do we need to expand it out? The adjacent nature of the behavioral health to either the EPAL point or the existing facility is not too far to transport a patient. Again, I hearken back to my days at Loma Linda. We'd had surgical centers down the road. We had other hospitals down the road. We transferred patients back and forth very easily, and there's medical transport teams that are very capable of moving patients between buildings. And on that point, I would make the point that you have the existing Guam Memorial Hospital facility that would not necessarily need to be completely condemned, but would work very well for a public health facility and a CDC-operated lab. So again, why are we spending limited dollars that eventually have to come out of our pockets as taxpayers to build this massive campus where we're replicating and duplicating buildings and structures that we already have in point? And lastly, I'm going to make the point from a patient's perspective. Yesterday, I had a Manonko that came in that was in her 88th decade of life. Short of breath, very difficult breathing. She'd come to the primary care office, which is where patients should have their medical home. And we saw her and assessed her, and here she'd driven in quite a distance to come in, and it was very rapidly apparent that she needed emergency services. And so with this whole argument of, well, the doctors are saying it for selfish purposes, is again hubris, because these non-governmental services are very, very valuable to the healthcare delivery of the community. They're already existing in Tamuning. Patients have their trust in these services, and they are coming to these different offices in the core of either Tumon or Tamuning for it. And so here they come from home to seek their care, to receive their care, and then we're going to transfer them by 30 minutes across the island to a new facility. That doesn't make sense to me at all. The hospital needs to be adjacent to the existing medical infrastructure of the community so that we can work in a private-public partnership in order to deliver care that is safe and effective and affordable to patients. I think that concludes my main points. I just reiterate again the point that we are living in the wealthiest country in the world. We should not have water pouring through our roofs and snakes coming through our roofs in the hospitals where we deliver our care.
Merci, Doctor.
Thank you.
Is the PowerPoint ready for Dr. Shea? Is it ready? Yes, okay, it's ready to go. Go ahead, Dr. Shea.
Thank you, Madam Speaker, and fellow senators here. I wish Mr. Fisher was still here, because I think
Sorry, just state your name for the record.
Dr. Thomas Shea. I'm the department chair for the Obstetric and Gynecology Department of Guam Memorial Hospital, and I'm the current chair. And I would speak on the majority of the OBGYNs there, and also the president of the Guam Medical Association. Again, I'm going to go through these slides real quick, and basically it's not slides that I've created, it's just basically some $6 million worth of research that's in this pamphlet in Matrix. So that's basically what I wanted to go through. I'm not sure if everyone has read it, but I just want to bring out a few points on this. So next slide. Again, this is the seal of the government that authorized this Matrix study that we probably shouldn't ignore, but kind of look into it a little bit more. Next slide. Now, in the Matrix study, they looked at building not just the hospital, but the entire campus. And when I look at that, and right away I tell myself, man, that is a lot for Guam to swallow. What is the most urgent item on this entire list is the medical center. And that is the most urgent aspect of it. I don't think we can afford to build the entire campus. Next slide. Now, today we're talking about potential sites. We're talking about EPAL. Let's take a look at these potential sites that they take a look in the matrix. They basically look at over 10 sites, and they isolated 3 top sites. Eagles Field, next slide. Eagles Field, Adalcao, and EPAL Point. Now, when they look at these 3 sites, I'm sure they didn't just randomly select them. I think they looked at the $6 million worth that we invested into this study. Now let's take a look at a little bit of this choices here. The top 3 sites, right? They look at, next slide. They look at, I'm sorry, that's kind of small there, but it's in the matrix, table 2.2. I want to point out section 5, 6, 8, and 10. Probably the 4 most important part of their consideration here. Density of population, and we heard the governor from Guadeloupe issue a press release saying that don't build a hospital for doctors. Okay, fine. Let's build it for patients. I agree. Let's build it for patients. The matrix study that we invested $6 million in have isolated majority density is in Tamuning for the population, including travel distance, emergency response time, distance from clinic to the hospital. Next slide. Now, comparing EPAL, Adalcal, and Eagles Field. Eagles Field is out of the play. The next highest ranked, according to the matrix study, is EPAL Point. And that's according to the $6 million investment. I'm going to stop saying $6 million. That's kind of redundant there. But we know how much we invested that. So we're not going to take this matrix study lightly. We're going to look at it. Look at number 5, population density. It rated EPAL Point and Adalcal equal. But later on, I will show you, if you read more into their mapping, EPAL Point will come out way ahead of Adalcal. Travel distance. Look at the travel distance. This is not for doctors' travel. This is probably for patients. Access to care. Number 3, which is the highest point that they can get. Matrix has ranked EPAL Point number 3, which is the top access for patients. Number 1 is the lowest, which is Adalcal. That is the lowest access for patients. So when Guadeloupe is saying, let's build it for patients, that's EPAL Point. They need to be focused on. And that's based on this matrix study. Now, when you look at emergency response time, it's equal across the board. Eagles Field, Adalcal, and EPAL. But then I would disagree with that part because I think EPAL, emergency response time, is much faster. Not just for doctors, but for patients as well. Now, when you look at number 9, proximity of arterial roads, EPAL Point ranked above Adalcal as well for proximity for the arterial roads. Distance from clinic and hospital. That may not be important to Mr. Fisher, the senator, who just commented about the investment of clinics within Tamuning. But I'm going to explain that a little bit more later on, that proximity to clinic and hospital, to the hospital, saves lives. It's not about money. It's about saving lives. And that's what we want to focus on today. Now, 15, look like construction costs. Is ranked EPAL Point. Construction cost is better. It's better than Adalcal. Land use and zoning compatibility. Number 1 is EPAL Point. Number 1. So the total score is actually higher, much higher than Adalcal partial. So when the Guadeloupe is issuing press releases, I don't think they read their own report that they invested $6 million in. I'm very shocked and surprised about that. What a waste of money if you're not going to pay attention to it. Next slide. Now, the drive time analysis, and I'm glad that a speaker had brought this up before, because when you look at the details of the drive time analysis, it's important to note, when you look at the drive time analysis, it talks about death and serious injuries, okay? The optimal time to get a patient or access to the hospital is 10 minutes. 20 minutes, okay. 30 minutes, acceptable. Once you get past 30 minutes, the outcome is not desirable, which means death and morbidity will increase. So when you look at this, look at EPAL Point. Look at the matrix study. I didn't create this study. It's actually a beautiful study when you read it because it favors EPAL Point by a wide margin. Next slide. When you look at this map right here, pay attention to how they map this out. And many of us may just read it. I've been studying this. And look at 0 to 10 minutes. You got almost 36,000 population of patients that have direct access within 10 minutes. If you have a heart attack, you're in labor, you're bleeding, trauma, you're going to need access. You got 36,000 in that population there. Now, even when you go 20 minutes, EPAL Point is still higher. Next slide. When you look at this next one, this is talking about Adalcal, which is what Guadeloupe is focusing on. And they're saying we're going to build this out there because it's better for patient access. No, it's not, according to that $6 million study. Read it. 10 minutes. It's only 13,000 people that's accessible at 8% of the population. Even when you go to 20 minutes, look how big the blue map they have to draw out to include 92,000 population. EPOW point is still higher for accessible to the population, according to this study. Next slide. Now, here is the thing that's concerning about a Dalcal land partial that they didn't read. Well, I don't know if I'll read this, but just read it. Costly development constraints, longer travel distance, sizable cost of extending and expanding utilities. The site was incompatible with existing land use and current zoning. You're going to have to do that. That's going to have significant disruption during development. The drive time analysis of Dalcal in 2-.4, I already talked about that, is that the land part is way worse than EPOW, way worse. So, if we talk about access for patients, it's not for doctors. Patient needs to get to the hospital. Now, this is the next slide. Is actually quite important slide because table 2.5, I've isolated this, okay? Look at Eagles Field, that's out. But if you look at EPOW Point, there's no cost to the land where you have to spend money to buy the land, the crown land at Dalcal, which belongs to the ancestral land. Now, when you look at the level and the building, it's pretty good, EPOW, because we've built there before. If you look at secondary access, there is no secondary access to Dalcal or even Eagles Field. But we have secondary access to EPOW. It's already there. Look at on-site utility. There are some on-site at EPOW. There's none at Dalcal, even Eagles Field. Now, if you look at the other one, water infrastructure, wastewater, power infrastructure, road transportation, each of those costs over an average over $20 million to each, over 100 and something million just to include those. $5 million to upgrade on EPOW Point. That's a significant amount of money that you can save. That can go to medication and supplies to save lives. I'm almost done. Now, telecommunication. Somebody mentioned telecommunication is better. I think William Kando mentioned that, you have to build this big campus because we want to collaborate with, who are you going to collaborate? The only people that can collaborate is Gov Guam themselves. They're not going to collaborate with the community of private doctors. That most of the private doctors actually help save lives at the hospital. Okay? So when he's saying, we have to have the EHR that communicates in the same, no, it doesn't. I can communicate with Hawaii, Kapilani with my EHR. I can communicate with San Francisco, UCLA in my EHR. So what they're telling you is not the truth. Okay? You don't need a whole campus to be able to communicate and collaborate. Now, if you look at sentiments of doctors and medical community, I didn't get a survey, so I have no part in this study at all. But look at what the matrix says. Negative for Dalcal, negative for Eagles Field, positive for EPOW Point. And I wasn't even including this survey. Now, if you look at community support and perception for EPOW, it's supportive. The other one, neutral. So this is a study that we pay money for. Now, just to go back to the footprint, and I think you mentioned, next slide. It's important to recognize that we have apples compared to apples and apples, right? That's what Kanda wants to talk about. Look at this slide right here. This is Straub Medical Center in Honolulu, Hawaii. That's the hospital I go to when I have to have my physical done. Now, take a look at this now. They're building almost 1 million square foot of space within their own footprint of less than 5 acres. Oh my goodness. I have no idea. If you keep talking to Gov Guam, they're never going to build anything. Look at Queens Medical Center. They're expanding the bed. Next slide. Queens Medical Center is expanding to 720 beds on the same footprint in Honolulu. Next slide. Kapilani Medical Center. That building right there is already up. That is the Children's Medical Center. So needed for Guam. And Kapilani has built it on the same footprint. They didn't go out and buy land. They didn't do anything. They built it in the same footprint. So I would challenge Gov Guam to also look at GRMC. Next slide. GRMC is built in less than 8 acres of land. 8 acres of land. Take a look at that. It's right down the road. Consult with GRMC and ask them how did you build this in less than 8 acres of land? And they have room to expand. So, the government of Guam really needs to take a look. When they talk about collaborativity, look at the private sector and what we're doing. Okay? And then to answer the question, Mr. Fisher, I know he keep leading on Mr. Kando, right? The way he asked questions. He didn't ask questions. He basically asked questions and answered himself. Basically what he's saying is this. He just said, Well, it's because maybe those doctors that support if not here, or those doctors who support it have invested in the Tamuning, the medical complex near the hospital, then they're going to have to chasing the new hospital. Well, partially he's correct, but on the other hand, if you really think about it, even if you start building a hospital right now, if you build in Acalcal, I bet you it won't even be built within the next 8 years. Majority of us, what we're going to do at our clinic, we can do surgery centers, right? Guam Surgery Center is operating right now. Most of the major surgeons have to respond within 10, 15 minutes of trauma at the hospital. OBGYNs, who I represent in my group as a chair of the department, 100% of us has got to respond within 10 to 15 minutes to emergency. And when a woman is in labor, when they bleed, they can die within 10 minutes if you don't get there to stop that bleeding. So who's going to take care of this patient? Not Mr. Kendall. He's not a doctor. He's not going to be there and take care of it. So I wish Mr. Fisher were here so I can answer more of his questions. The other thing that I'm so dumbfounded is this. When they talk about cliff line, oh, wow, we don't want salt spray. Senator Lujan said it right. There's salt spray all over the island. I have a car parked in the middle of the island, and I park in my friend's house, and I say, hey, there's no salt spray here. The next thing you know, there's rust all over my car. I'm like, what happened? It's not a cliff line. It's all rusted up, and it's in the middle of Manila right now. So it doesn't matter where we are in the entire island. I think what we need to be concerned about is when are we going to build this hospital? If you keep having the same Gulf Guam people here that say, we can't, we don't want, we can't, we don't want, we're never going to build it. We're never going to build it. Just like labor and delivery is never done. And it's 6 years, going on 6 years in this administration, that they promised to get it done and still not done. And it's going to be another 6 years before you build a new hospital. But I can tell you this, senators, if you want to build a hospital within the next 3 to 4 years, Ipaw Point is your land to build it on. Because that is the only land that I can see that can build a hospital as fast as it can. Not at Dawkao. If you want to do ecological study, I'm not an ecologist. I'm not a geologist like Mr. Kendall thinks he is. You would still have to do a geological study in Dawkao. And let me tell you, read the matrix study because it talked about sinkholes. And under Dawkao, it says questionable sinkholes. So you haven't even dig there, and they're already telling you there's maybe sinkholes. So you may have 100 acres, but 50 of them may be in the sinkholes. All right? Anyway, next slide. Anyway, I just want to thank Matrix Consultants for the $6 million study because I think it's a wonderful study and supports Ipaw Point as the second choice to Eagles Field. Thank you very much.
Thank you, Dr. Shea. Please proceed.
Hi, half a day. My name is Denise Tyson-Ritter. I am a family medicine physician at American Medical Center, and I, along with my colleagues on this platform and other people here, support the build of a potential hospital at Ipaw Point. When we think about a location of this building, we have to think about its function, and its function is to serve its people. And so, just like Dr. Thorpe had mentioned, we have more often than we'd like to see our patients coming in with pretty concerning symptoms, right? Concerning for heart attack, stroke, respiratory distress, coming to clinic. They need emergent transport. The time it takes to transport from point A to point B is vital because time is tissue. And so that is incredibly important to have a site with accessibility, with routes, multiple routes where you can access. In addition to that, how quickly can your specialists get to that site? Our OBGYNs, our cardiologists, our radiologists, how quickly can they get to where they need to be to save lives, right? So our specialists are located in close proximity to the hospital for this reason. And so, using Ipaw Point takes advantage of the infrastructure already in place. And so, again, this hit pretty close to home when my mom suffered a heart attack days before Mawar hit. And so, you can imagine my shock when I received her text while I'm in clinic saying, man, I have chest pain. And I call in a panic. I said, don't you come here to clinic. I said, go straight to the emergency room. I had a family member who had enough sense to take her to the nearest fire station and transported her to GMH. And so I rushed to GMH from Tumon Clinic in what seemed like hours, eternities, but it was minutes. I'm just wondering if I was too late. She had the best possible outcome. She was stabilized in the emergency room. Cardiologist saw her, and eventually she was stented. But it's because these things are in place. The infrastructure is what it is because it makes sense for our people. And so having EPAL Point as the location allows for multiple access points to get to the hospital, whether it be multiple, vehicle collision, inclement weather, road construction, we can still access that spot. Additionally, our specialists are there. They will be there in minutes notice because minutes matter when we think about heart attacks and strokes. You're going to want your specialist to be there as soon as possible. That's it.
Thank you very much. Doctor, Doctor, can I confirm your name is Denise Taitano Ritter? That's you. Thank you. AMC Clinic. All right, thank you very much. Dr. Wen.
Hi, good afternoon. It's a very interesting afternoon. But again, my name is Huang Nguyen, and I'm not going to say much because I'm here just as a primary care physician and a principal partner, probably the largest primary care clinic in Guam. For the record, I am myself and the majority of AMC providers do not have any admission to GMH. So we provide primary care service to about 35 to 40% of the Guam population. It's a huge clinic. And I will concentrate on just one subject today, which is the new hospital and the location. We talk about a new hospital versus a new medical complex. It's a totally different discussion that you don't want to hear from me because it's going to take me the whole day to say things. But one advice to the governor and the senator is that from my healthcare point of view, what it was is we only need a new right-sized hospital and not a medical complex. As Dr. Shea and the rest of my colleagues say, with the status of GMH, we cannot keep beating this bush and want a medical complex. It would absolutely make no sense. We need to build a new hospital of right size, not 300, 400, 600 beds. We have no staff to take care of that. Right size means probably about 150 beds is the max because we don't have nursing staff to run it. Again, I kind of disappointed the administration say about the physician, and we talk about this location because it's selfish for the physician to do, and we don't take care of our medical provider. The administration have to understand that GMH is for acute care service and not by any means provide the primary care service that we as a clinic does. It's an acute care service. The acute care service should be close to the majority of the primary care clinic and the ancillary service, like the surgeon center, the radiology center, the special center, as the center augment the care, the acute care service. But acute care service cannot be so far away, and they don't provide primary care service. It's a big difference. So when she want to build all the way on Annandale, it's not a chronic care service. That's us. It's for primary care. That's not the hospital. So you got to understand the difference of acute care and primary care service in choosing your location of the hospital. That's our business. And just like Dr. says, I'm not sure who they consult for physician to provide this this location in Manila, but I don't think that any physician would step up and say, yes, they talk to me. We ask around and nobody say that they talk to anyone. So I'm not sure who the physician are that they're talking to. For GMH to be so far away, and we stretch about 10 minutes away from the center, is really detrimental to the patient care due to delay in the response time as a transport of the critical patient from the center to the hospital, and for the physician to travel to the hospital when needed, especially, if I used to be on call for the hospital, and for me to travel from my clinic at AMC Tuman to the hospital is 10 minutes. For me to go from AMC Tuman to Manila, I don't care how much little traffic, it's going to take me 20, 30 minutes to get there. And by that time, my patient will be in trouble already. So the location and the time for travel is very important. All three major clinics, and again, the ancillary service like GRC, MDX, Surgeon Center, every one of them, including the former Burton Center, are within 5 to 10 minutes to the current GMH. EPAL, the same thing, less than 5, 10 minutes. And I can tell you, in anything that I can argue with, I can sit here and debate this with the government if they want anytime. You can tell the patient that call on your line, say, I have chest pain, shortness of breath. You can tell them to go to the ER. Please don't go to the clinic. 90% of the time more, they will show up in your clinic. They don't like to go to the emergency room. That's reality. So they need to be somewhat very close to where the hospital is. AMC Manila is the only medical center close to the current new proposal that they want in Manila. We are the only one. So Manila site, we own that. We still speak against it because we are the only one out there, but it's selfish for us to say that's the best location for Manila when it's going to be detrimental to people of Guam. AMC Manila cannot be doing that. It's better advantage for me, but for my patient and for the rest of the population of Guam, it's not good. So, again, Senator Fisher, just like I get insult when he say that, for our best benefit, because it's advantage to us because we want to move our clinic. Senator Fisher, I have 2 clinics, one in Tuman, one in Oka, okay, and one in Manila. Manila is the biggest one for us. I speak against it, not because advantage to me for anything about financial-wise, but because for the patient care. So we are here for patient care. So please, consider. I really, really speak for myself, for my colleague, and my patient. We shouldn't have a choice. EPAL is the only choice. Or somewhere in Tamuning, just pick one where the access to care for majority patient is the key for survival. Thank you so much.
Thank you, Dr. Nguyen. Again, thank you to all of you who've appeared today. Are there any questions from senators for this panel? Senator Dueñas.
No question, Madam Chair, but I think I just needed to clean one thing up. I did notice that in our packet there was the testimony on the May 17th to where the Guam Memorial Hospital Authority, Office of the President of Medical Staff, strongly in support of EPA Point. I just wanted to close with a comment. I mean, in your profession, Madam Chair, in the legal profession, a lot of times it's called asked and answered. I think all the questions have been asked and the answer is EPA Point is the place. I also want to join with you doctors in saying that I have a lot of difficulty because my wife is a critical care nurse, so I know a lot of what takes place. And I do know, and also I think it's kind of not even hard for people on Guam. When you drive past a dialysis center, a lot of times you'll see an ambulance outside. I used to wonder sometimes and shake my head, even next to the hospital. I live close there too, and you see an ambulance in front of the Parisville Clinic going up to the hospital. Because like Dr. Nguyen and all the doctors are saying, the majority of the time when an individual ends up in crisis, especially on Guam, our healthcare is not going to change for a long time in terms of the acute situation with a lot of our people. And where they're probably going to get their life-saving transport is going to be from a clinic to the hospital. And so the bottom line is to implicate whatsoever that there's any type of, financial interest. I would say I'll flip the script. It may be the other way. Because who will benefit from having to be at the doorstep of the foundation of trying to transform what it's going to look like? Every single one of you have invested your time, your education, your love for Guam to stay here and to try to treat and save our population. So I'm going to remain invested in your integrity and in why you come before us today to plead that this is the best. Dr. Shea, I have to admit and confess that I perused the report from Matrix, but you've basically given us a clinic today that we could use your PowerPoint to
Yeah, please do, because
Yeah.
that, you have it saved, look at it, meet in your caucus, and Senator Barnett, you can use that for your bill, and by all means. I have more to say, but I had to cut it short out of respect for, time. I didn't want to get cut off, but
Yeah.
I think it's important to look at the study. We invested $6 million in that study, and that study tells us EPAL point is good for the hospital. It's good for the hospital. And no disrespect to Guam Memorial Hospital, their staff, if they're taking marching orders to go against this, but they have to think about patients. They're not there to take care of patients, we are. We're there seeing blood. We have blood in our hands every day, saving lives. So they need to at least give us some respect and hear us out and look at their own $6 million study. Like Kendall mentioned about this cliff line, somebody better call the admiral and say, they better, for the Chamorro Land Commission, I would really plead with them, and I represent the voice of many of us, is that the best investment for that land is not to build a casino or the convention center, but to build a hospital so that you can save more Chamorro lives. So I think that's important for them to consider, rather than just the monetary aspect of it, because I think that's important for the Chamorro. I may not be on Guam forever. We're not going to be on Guam forever. 27 years is a long time for me to be here. But I also want the governor to know, if she's watching or listening or at a loop, I'm sure they are, is that we're not against her. We want her to succeed. But to succeed, you have to be able to work with the doctors and the nurses who are going to be on the ground. We're the soldiers on the ground to save lives. We're the one that getting our hands on the patients and getting the arteries stopped. So I hope she listens and work with us, be part of the solution. And I hope she's listening to that, and we want her to succeed. We want the panel here at GMH to succeed. I want Mr. Kando to succeed. But to come here and keep saying no, that's not productive. And that's why this hospital never getting built. So I hope that Senator Barnett's bill gets passed. I hope EPA points the one.